Blackwork style technique. Galina works at 110 Hz frequency and never changes it. It's a relatively high speed, so it's recommended to start with a lower one. It's beneficial if the client scrubs the area before the session, as this helps remove the dead skin layer. The hand movements resemble a pendulum moving back and forth, with a slight effort towards you and no effort away from you, working like a printer, shifting gradually to the side. Circular motions are also possible. It's crucial to find a balance that allows you to deposit as much pigment as possible without causing trauma. The number of passes depends on the skin type. Thicker skin is harder to work with and requires more effort, while thinner skin absorbs ink faster but gets injured more easily. The skin in the video has an epidermis layer above average, and due to previous tattooing, scarring, and some amount of white ink inside, the pace of work is moderate. Areas with previous tattoos might look raised, but within a few weeks, the skin will level out. Some clients have genetically thicker epidermis, in which case you can slightly increase the needle throw, but it's important to be cautious with thinner skin areas, typically the inner arm, elbow bends, and wrists. Covering colored tattoos is more challenging. Some colors are harder to cover, with white being the most difficult due to its thick and opaque nature. Colors containing white, such as light blue, pink, and light green, also pose difficulties. Covering them depends on the skin's durability. If the skin allows for longer work and therefore more black ink deposited, light shades can be covered in one session. However, white often requires a touch-up session. A common issue for beginners is overworking the skin by trying to deposit black ink using improper equipment and without knowing the technique. This often results in scarring and light spots appearing after healing. The second issue is undersaturation. Fearing over-traumatization, the artist doesn't deposit enough pigment, resulting in a watery finish. Before beginning a touch-up, thoroughly analyze the upcoming work, assess the skin, and don't hesitate to seek advice from more experienced artists. To identify skin trauma, don't rely on the amount of blood. Traumatized skin has a velvety appearance. When wiped, healthy skin looks smooth and glossy, whereas damaged skin appears dull and matte. With practice, you'll develop a sense for when the machine's vibrations change slightly, becoming smoother without a springy response from the skin. Proper skin tension is crucial and is achieved with 3 points: 2 fingers of the left hand and the pinky of the right. Although here on the forearm, the skin is usually well tensed naturally. The machine should be held at a perpendicular angle, though a slight tilt is acceptable to reduce needle resistance, especially with large needle groups. Additionally, hold the machine firmly with a stronger grip, but don't apply pressure. Let the weight of the machine do the work. Blackwork is not particularly painful for clients because the needles are distributed over a large area, making the sensation less sharp than with smaller needle groups. However, the large area of skin damage over a short time means clients may struggle to tolerate it after 2 to 3 hours. It's best to either pause the session or offer pain relief to help calm the nervous system. If you're new to this style, avoid rushing to complete a sleeve in one session. Work at a comfortable pace. Speed will naturally increase with experience. Despite the large amount of pigment deposited in blackwork, it's not highly traumatic because the artist rarely goes over the same area twice, unlike in color tattoos. Mastering blackwork techniques will benefit you in many areas and add variety to your existing skills and style.